I'm doing well. Thank you so much, President Clarke. President Rose, excuse me. I'm so used to thinking Clarke, 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 Clarke. Welcome everybody. Welcome everybody to Health IQ, another edition of I'm Rashad Milligan. Thank you all for tuning in. You guys got a little preview right there. We're here with members of the Atlanta NAACP, Dr. Melissa Clarke and President Richard Rose. Once again, he was on last week, if you all remember. Folks, how are y'all doing today?
Doing fantastic. How are you?
Man, if I was doing any better, I don't know what I'd do with myself. It's just been an amazing week. But we are here to talk about vaccinations. This is something that President Rose and I talked about last week. But Dr. Clarke, you got your setup there and everything like that. And you got the white coat in the back. I want to, before we go any further, what's going on with the background here? I see the degrees, I see the white coat, I see the books, and I see the microphone set up. What do we have all going on here?
Well, I have a streaming show called Excuse Me, Doctor, and it's on YouTube and Facebook every Monday night. This is the setup that I use for it. We take audience questions live. We just want to make sure that everybody is getting all the information that they need to be their healthiest. That's what we're about.
Well, sounds good. Sounds good. Everybody make sure you check it out. Like she said, YouTube, Facebook, Dr. Melissa Clarke. Without further ado, let's get into it. The reason why you guys are here, like I said, vaccinations once again. And Dr. Clarke, we'll once again start off with you. What is the role of vaccinations in the community?
Excellent question. Vaccinations overall are the safest way to expose your body to a germ, whether that's a bacteria or a virus, so that your body can build an immune response. What does that mean? An immune response means that your body has soldiers now that are designed to specifically take out that particular germ, that virus or that bacteria, as soon as your body might be exposed to it. So when you have an effective immune response, the virus doesn't have a chance to take hold and multiply in your body. Now, there are only two ways to get antibodies: to get the infection or to get vaccinated. So getting vaccinated is the safer of those two ways to get, to build immunity, to get protected from a particular virus or bacteria. So in the setting of a pandemic where we've never been exposed to this particular virus, vaccination was the safest way to make sure that the majority of the population could get protected, to slow the spread of the coronavirus through the population, and to decrease hospitalizations and deaths from COVID.
And Dr. Clarke, just to follow up on that, you said it's either two ways to build antibodies. You get it or you get vaccinated. So if I get it and then I get vaccinated, am I like double?
Yes. So studies have shown that if you had an infection, your immunity wanes, so your body's ability to produce those antibodies goes away eventually over time, after about 3 months. So getting vaccinated actually re-ups you, if you will, to make sure that your immune response and your ability to produce antibodies immediately when needed is at its prime.
Right. And President Rose, now your thoughts, just kind of following up on those words from the doctor over here.
So as I might have said, I followed the science. I followed the nerds that were on the other end of the hall from me. I'm a CPA, I'm an accountant. So the last science course I took was physics. So I followed those students who were very serious about the sciences, that kept going to college and graduate school and medical school. And so my reading says, this is the best way to protect me. I'm a baby boomer. I cannot afford serious respiratory illnesses. I'm asthmatic, and so that's a double. I don't have high blood pressure and diabetes, but I want to be effective in what we do. My job as president of NAACP is to fight for civil rights. And so I don't need a coronavirus vacation. I need to be ready to go to work and fight every day.
And President Rose, so to follow up on that, something different than what we kind of maybe touched on last week, but the second booster shot's coming out. Are you getting all of the booster shots as well as they are available to you?
Absolutely. No question about it. I've talked to other scientists and doctors other than Dr. Clarke, for whom I have much respect. And so I will be scheduling as soon as I can get scheduled for this second booster. I will take it. I'm a little bit, I'm pretty healthy, but I'm a CPA. So I got until Monday, I've got long days. So as soon as I get a short day, I'm headed over to the nearest, I think they're giving them in Atlanta at Walgreens. So I'll get on that list. They start about 9 or 10 o'clock and they done by 5 or 6. So I got to get in that window, but absolutely, I will be getting that second booster.
And Dr. Clarke, also just to follow up on that, can you anticipate how many boosters are going to be in the plans right now?
There's no way to anticipate that. What we've been following the science, and that's one thing that I think has not been emphasized enough in this pandemic. This is a once in a lifetime event. And we unfortunately have had to learn as we've gone along. And so we've seen that with vaccination, there has been a waning of immunity. The vaccine still works to prevent hospitalization and death, but over time doesn't work as well to prevent infection. And so that's the need for the booster. And so as we keep going forward, we're seeing, well, how long is this one going to last? And we're getting more and more effective vaccinations coming down the pike. There's one in development that's just going to be sort of like a nasal inhalation, and that will protect more against infection because that's where the virus enters your body 9 times out of 10 is through inhaling it through your nose. So a booster or a vaccine in the nose is thought to be more effective over time, and so that's in the works. And so we're just going to have to watch and follow the science, as President Rose said, over time.
So kind of like an allergy medicine, you know, it's allergy season here in Atlanta with all the pollen and stuff.
Yeah.
Just to follow up now going on to the next question, how did you guys feel in the pandemic when there was no vaccine versus now with the vaccine available?
You want to take that first, Dr. Clarke?
Sure. Well, I feel much safer now knowing that I myself am vaccinated and boosted. I helped take care of my elderly mom and father-in-law. And so it was very important to me to remain healthy, to remain, be able to do that and, reduce the risk that I would be taking something to them that they might not be able to handle. And this is a rapidly changing pandemic. As I said before, 2 years ago, we knew virtually nothing. We now know that vaccination protects against hospitalization and death. But we know that we still have to, even if we're vaccinated, if we're in a crowded situation or a high risk situation, we still have to mask. So I'm still doing those appropriate precautions, even as I venture out and go to concerts again and do some of the things that I've missed over the past couple of years. But I'm also going to be getting that second booster, right? And I also use testing a lot when I know people are going to come spend the night at my house or come over for a meal where they're going to have to take their mask off. I require them to get a PCR test in advance, right? And I might also follow up with a rapid test when they walk through the door. So we've been super careful, even though we're vaccinated, just to make sure that we're not putting ourselves or our families at risk or possibly getting COVID and having long COVID, which doesn't get talked about enough.
Similarly, I'm still very careful. I'm masking in public places. We still don't have in-person NAACP meetings for our governing board or our membership. We still doing virtual. Actually, I may be even meeting more virtually than I was back in 2019, pre-pandemic. So again, I'm following the science and still careful. As I mentioned, I know what a nasal vaccine is like sprayed because of my own allergies. And of course, Atlanta may be the allergy capital of the world, And so I continue to do that. But we had some meetings today. I was masked up. We doing get out the vote rallies to start how we're going to approach the other things that the NAACP is charged with in our communities.
And to follow up on that, you know, I know President Rose, you just said that, you know, you're following the science, you're listening to all the students that you went to school with that, you know, took those studies seriously and kept going. But I guess, Dr. Clarke, you know, what information helped you decide whether or not to get the vaccine?
Sure. And I was very skeptical at first, but I really read over those first studies that came out. I realized that there was about 10% participation of African Americans. So I found that reassuring. I know from past history of all vaccines that ever were that side effects occur within the first 3 weeks. And, you know, there were many people that went before me who got vaccinated, and I saw that, you know, they didn't have those serious side effects. I also knew that the vaccine itself is just fat, sugar, salt, and the virus genetic material. And the virus genetic material didn't scare me because we have virus genetic material living in our bodies from when we got infected with whatever we got infected with as a child, right? So that chicken pox, exactly. So that didn't scare me. And then I know that the other vaccine contents, or the vaccine contents in general, get destroyed within minutes of entering our body, entering the cells. So I knew that. And then I knew all that other stuff was just fluff and hype, right? The 5G, the microchips that is coming into our community from people that don't mean us well. So that part didn't bother me as well. And in the final analysis, it made much more sense to get vaccinated than think that I could just go it on my own.
And from my standpoint, you know, with community interaction all the time, we could see we were losing a lot of people in the community suddenly. A friend of mine from school, he had been bedridden, and he passed, not from COVID, but the funeral homes were so backed up, they couldn't pick his body up for a day and a half. And so that was a real telling thing to me to say, our community is suffering. We have to do something to mitigate the effects of this new kind of super virus. And so when the vaccine became more available, I was reading some of the summaries of what Dr. Clarke just spoke about, because I didn't get into the details of what's in it, but I knew we had to do something to try to mitigate the effects of this pandemic.
Dr. Clarke, I really want to know your answer on this next one, which is, how do you think the unveiling, the releasing of the vaccine to the public has divided the country? Because, you know, you talked about how you require testing, you know, once you come to your house, if you're coming to the house for a gathering, an event, eating and stuff. I remember when, you know, during the holiday season last year, our family, there's a requirement, at least be vaccinated. And like we had a family member that wasn't, and they were upset, like they were fuming about it. So I just wanted to know, how do you think, from your perspective, that the vaccine has kind of divided the country, if you think it has divided the country at all?
It most definitely has divided the country. It's divided families. As you've said, I've lost a best friend over it, right? Which is unfortunate. You know, we've seen red and blue states have different vaccination rates. We've seen young and old. There's a division there. There's the people who believe in quote unquote natural medicine versus what they perceive to be Western medicine. So there's all these divisions happening, and misinformation does that. It is a nugget of truth wrapped in a lie. And it's hard sometimes to tell the difference between the truth and the lie. Lies that resonate stick with people in situations like pandemics because they feel out of control, and those lies are something that they can hold on to try to make them feel like they have some measure of control. And sometimes those same lies resonate with communities like ours that have been historically traumatized, because those lies cater to the fact that we have been, that it's easier to believe that the government doesn't mean us well, because that is our everyday experience. And so we have to keep in mind that this is a global pandemic, that everybody is being asked to take the vaccine, not just Black people, not just old people, not just young people, not just Democrats, not just Republicans, that it's for everybody to keep everybody safe in the context of 1 million people, 1 million Americans who've died, 6 million people worldwide who've died, countless of African Americans, over 100,000 African Americans who have died. The vaccine is the best alternative to that.
Yeah, so, from my perspective, we live in a world that's alternative facts on steroids, to coin a phrase from Kelly and Conway. And so obviously, that's an oxymoron. Alternative facts are facts. But we live with those. I live with that, in civil rights, that the Civil War was not about slavery, and we get all those things. They take a life of their own. People want to believe whatever that other side is. But I tell clients, new tax clients who come to my office for tax preparation, that the worst place to get your tax advice is at the barbershop. Well, that's also the worst place to get your medical advice. The barbershop and the beauty shop are not the places to take off a new set of facts and a new information and run with it.
Well, I guess, just kind of even beyond where you get your information and dealing with, I guess, the era of misinformation due to the social media and more people having the potential to reach a lot of people in thousands and millions, to move on from that. But kind of under the same boat, there's mental health. How have you all dealt with your mental health in this time, these past few years in pandemic, with the restrictions of, everybody being locked up in the house, to even, like you alluded to earlier, Dr. Clarke, going back to concerts and going back outside? President Rose, you guys are back out there right now trying to get people to vote, and you're on the ground doing the groundwork. How do you return and, still think about remaining safe and not, keep reminding yourself this is 2019. I got to remember to mask up, blah, 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 et cetera, et cetera.
Well, we do it very carefully. That's the bottom line. Paying attention to the science. For those of us like me who've never been infected, keeping those same patterns, and just being careful, keep waiting, hoping that the process for some kind of immunizations will, in the general public, will continue to make progress better. Because you said, when we listen to the doctors, they say the patients who are dying are unvaccinated. And so we will continue. We have to move on. For some people, it's been very traumatic. I was listening to a news report and people were railing that, we closed down the schools when it was the rate of infection was low again in the students, without regard that the rate of infection was not low for the teachers and staff who had to be teaching the students once they came to school. So, it's a lot of hyperbole, a lot of misinformation, and a lot of just, intransigence in some of the communities and some of the thought patterns and schools of thought. People operate in a bubble. They just keep the echo chamber, so they keep hearing the same thing over and over.
And as far as mental health, mental health has been the pandemic inside the pandemic, right? I mean, so many people have experienced loss, on top of all the other social distancing, et cetera. For myself, it's been isolating at times. My husband is a musician. He wasn't able to perform for a long time. So, there was that piece. And so I think, having routine, staying grounded, having faith, some sort of faith practice, meditation, getting outside, getting sunlight, getting exercise, getting sleep, because sleep is, when you're tired, depression can take hold a lot easier. So having those routines and really trying to stick to them is really important. Reaching out for help, knowing when, you might be hitting rock bottom, knowing the signs in yourself where you know that you're feeling sad or depressed, reaching out for your pastor, reaching out for your doctor, reaching out for your best friend. All those things are really important to really sort of keep you grounded and keep you centered, because, what we're seeing is that young people actually are suffering the most. And, we think, oh, well, young people are still socializing and whatnot. But I think what's happened is people that are older, like myself, we've been through more stuff in life, right? We have more things that have taught us resilience, whereas our young people haven't. This might be the first huge major challenge. And so it's really affecting them, and it's been tough.
Right. No, for sure. And you guys both kind of said routine. Routine is kind of key there in protecting your mental health, and then just staying safe among going back outside and going back to events in the public. So I guess that leads into the next question of, how has the pandemic affected the way that you approach your personal health?
Well, two things. I actually had an illness in the end of 2020 that required me to have surgery and be hospitalized. So between the pandemic and that, I have actually really focused on my own health. And I also, I realized that, there's a popular thought out there that you can build your immunity and be immune to COVID based upon taking supplements, right? And sort of being at your healthiest. People that tell you that, like, you could take supplements, they don't necessarily know how the body works, and they might just be trying to line their pockets. But it is important to realize that the healthier you are, on top of being vaccinated, the better your immune response will be. So the two things work together, right? As I said, there are only two ways to get antibodies, but being as healthy as you can be makes sure that your immune system functions as best as it can with the antibodies that you get from vaccination.
Oh, agreed. Yeah. I think the only adjustment that I made was I doubled my vitamin D every day. I was doing 1,000, I'm doing 2,000, but continued to try to maintain a healthy lifestyle, healthy eating, which I must do anyway. And so I just, the distances was the only adjustment I made. As she said, people, will try to sell you anything to line their pockets. But, taking advantage of your fears or your suspicions or desperation, even in some cases. So again, follow the science, follow Dr. Clarke and her colleagues around the country who are in it, not just for careers, but this is their lives, where they devote their energy to, and they vote their integrity. And so we're going to continue to follow.
Right. It reminded, Dr. Clarke reminded me of Aaron Rodgers in the NFL when he said, are you vaccinated? And he said, I'm completely immunized. And when they found out he wasn't vaccinated, the whole thing came out about him saying, well, I've been taking these supplements. And I said, I was immunized. I didn't lie.
Exactly.
But, and he got COVID. But I wanted to know from you all, who are three people in the medical professional realm that you guys could really lean on for information?
Well, I don't lean on people. I read studies. So I can't necessarily say that there's some, Dr. Rockstar out there that I follow. I go to the original source myself, and then I repackage that so that I try to make it understandable for the regular person. And that's what I do on my show. That's what I do when I talk to people, is just try to make that understandable.
Similarly, I'm fortunate I have a couple of physicians in the family. And so I call on them to see what the latest, but I'm continuing to read. And then our program director at the NAACP has a niece that is an epidemiologist. So if I'm at all concerned about what I've read, I call on one or the other to try to get some further understanding or validation.
And of course, like Doctor said, she wouldn't lean on professionals because she is a professional, of course. But just wrapping up now as our time comes to an end, I wanted to ask why social activism plays such an important part in health.
Well, we live in a society where there's not equality where it comes to healthcare or how we fare as Black people, right? Our health outcomes. And that's largely because the places where we live, where we go to school, where we work, our economic opportunities are unequal due to historic and current racism. So we know that social factors like housing, education, jobs, transportation, safety are more important to health than actual health care. So being a social health activist for me is about ensuring that Black people, right? And I will be specific because I feel that I need to look after my own community. But in doing so, in sort of raising the level of the water, all boats rise. If you raise it for Black people, you really raise it for everybody, right? And so I really do this, do social health activism so that everybody has an equal chance at health and prosperity.
That's kind of a drop the mic moment, so I'll I'll leave it at that.
Anything else, Brett? So, President, you say you're leaving it right there?
Yeah, I can't add anything to that.
Okay. All right. Well, President Rose, is there anything else that you'd like to plug to let the people know that's going on with the Atlanta NAACP right now that they should know about?
Yeah, so I mentioned, we had a big rally today with a lot of community partners to talk about how we're going to turn this vote out. And then I must say to everybody across the country, if Georgia, Atlanta and Georgia had not done what we did in 2020 and 2021, Ketanji Brown Jackson would not be the next Supreme Court nominee. And so we happen to do that. We are proud of our effort we made across this state, and we're getting ready to do it again.
If I could also add, we've been working with the NAACP to do Vax Now GA. If you go to vaxnowga.org, you're going to see some public service announcements about the importance of getting vaccinated. You're going to be able to find where you can go get vaccinated. You'll be able to follow what's happening with the numbers in Georgia. So vaxnowga.org. Please go check it out.
Good. And since you mentioned, we have another website, vaxxedup.org, vaxxedup.org. It's some information on misinformation, and there's some quite comical TikTok scenes. You might want to, you get a kick out of it, get you a soda or a stronger drink and sit down and have some fun with it at vaxxedup.org.
All right. You guys heard it here first. Vaxxedup.org and VaxGA as well. VaxNow GA. Make sure you get it right in the order of. Don't be like me and Google the wrong thing. But make sure that you guys do that and check out the TikTok and enjoy it, have fun with it, and continue to, I guess, spread the good word. If I shall say so myself. For our Health IQ, we appreciate it so much, President Richard Rose and Dr. Melissa Clarke, for coming on to Health IQ this week. Once again, I am Rashad Milligan. You all have a safe and great week. Until next time.
Thanks for having us.
Thank you.